Dr. Michael Stroke.
Actually, I have been to India for at least 50 times. The first time I came here when I was 18 years old, and I worked in a slum clinic in Mumbai, and we always had visitors from India in our house in Germany. And I have been lecturing for Indian doctors, and what I have noticed over the last 20 years is that their knowledge and skills have improved considerably, and more recently by the Apollo Clinic supported, but also by Abbott, who have supported many of my lecture tours, and are quite optimistic that you, as you already mentioned, will also attract patients from abroad, from the Gulf area, for instance, who come to such a center to be correctly diagnosed and treated. And I'm very optimistic about that for the future. Thank you all.
Thank you.
Madam.
Okay.
Sir, cut it, sir. Ready? Ready, ma'am? Ready?
Make a few statements about Chakra. Chakra has a very bad reputation, and this was already stated by my kind colleagues. But actually, if doctors are well trained, then even general practitioners can make a correct diagnosis in 90% of the patients. In other words, you don't need these specialized doctors for the majority of patients. What is required that we improve the diagnostics in vertigo and dizziness. Education, 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 and self-confidence by the doctors that they know, yes, I can. And this should already begin in medical school. Although vertigo is so frequent, in medical school, in university, it's treated like an orphan disease. It's not part of the curriculum in a proper way. The second problem, and this is noticed by the colleagues here from ENT and neurologists, is that patients fall between the chairs of ENT and neurology. And although the title here is integrated, let me tell you, it doesn't work in clinical practice properly. So to put it in a positive way, the doctor who sees patients with chakra should be well trained. What are the keys to the diagnosis? So first of all, speak to the patient, listen to the patient. I see a lot of patients every week, general neurology, on my own. And my first question is, Dr. Prabhash, why do you come to our hospital? And he will tell you the story. He's the best and primary source of information. What I actually do not do is to look at the files for two reasons. Either the diagnosis is already correct, then it's boring. Or the diagnosis is wrong, and then you are biased and have to make a U-turn. And the four key questions when a patient comes with chakra are very simple. First, the time course. Does the patient have episodes of vertigo, an acute onset, or persisting symptoms? The next aspect is what type. But that's waste of time because most patients do not discriminate between spinning vertigo and postural imbalance precisely, or they have both. The third aspect are provoking factors. Do the symptoms occur spontaneously, or are they provoked by anything, turning around in bed, for instance? And the fourth category is accompanying symptoms. As you noticed, they can arise from the brain, from the extrapyramidal system. Almost all patients with Parkinson's, they initially complain of dizziness. It can be brainstem stroke with double vision. It can be hearing problem as in Meniere's disease. It can be headache as in vestibular migraine. So this is very important. Accompanying symptoms, provoking factors, so these are the four aspects. And then I examine the patient. And for examinations, we have just 4 tests. I look at the function of the vestibular reflex by turning the head to the right and to the left, to the diagnostic positioning maneuvers. Have a careful look at eye movements, do the positioning maneuvers for BPPV and the Romberg test. Then you have a diagnosis. You don't need machines. We have reclassified all vestibular disorders over the last 15 years. Doctors can download the diagnostic criteria from the Journal of Vestibular Research for free. And if you read them, you will notice almost no machines. It's about brain work, it's about listening, it's about physical examination. And this can be done by any doctor. Only 10% of the patients need specialized centers like here, but the vast majority, and here in India, we have about 450 million people with dizziness. Yeah, so it's a huge population. This should be handled by the GPs, and very few come here. And once you have made the diagnosis, we can treat patients. Straightforward. The first thing is tell the patient what is the diagnosis. They need to know what they are suffering from. That's a great relief. And then we can have physiotherapy, we can have medication like betahistine in Meniere's disease or other diseases mentioned, very rarely surgery. And one category which is often neglected, this is called functional dizziness. Patients are permanently dizzy because they permanently check their own balance. And this has to be diagnosed. It can be primary or secondary, and the treatment is speak to the patient and tell them what they should do and what not. So, my take-home message is, yes, we can. We need well-trained doctors. That's step one. Begins at medical school, and then we need doctors who know, yes, I can. And then it's really nice to have dizzy patients. You should love your dizzy patients, and they will love you. So it's a win-win situation, and you improve functioning and quality of life in 90% of your patients. So be optimistic, straightforward, like your dizzy patients, and they will love you. Shukriya.